afternoon and welcome to Warrior News. I'm Danielle Baez.
And I'm Allie Gorski.
Today's top story is the conviction of Lori Williamson for abusing her 3 children. Lori Williamson is said to suffer from a psychological disorder known as Munchausen syndrome by proxy. Today we will be dedicating an informative segment to Munchausen's and Munchausen syndrome by proxy.
There are 2 forms of Munchausen's. The first is simply Munchausen syndrome, which is a disorder where the patient fakes illness for the attention and sympathy that they receive from others. For example, when Lori Williamson appeared for the first time in court, she arrived in a wheelchair claiming to be paralyzed, which authorities say is untrue. Munchausen's by proxy, on the other hand, is when someone, a mother in Williamson's case, induces or claims that the person they care for is ill. Williamson claimed that her children had an extensive list of paralyzing illnesses. When they were taken into protective custody, they were fed through a tube and all were in wheelchairs. Since then, the children have recovered from their illnesses that the mother claimed they had.
Although the root of Munchausen's is unclear, professionals believe that there are many psychological factors that may induce Munchausen's or Munchausen's by proxy. Though many mental disorders have both biological and psychological factors, experts cannot find any evidence supporting the role of genetics or biological factors in a person who develops Munchausen's.
It is believed that childhood trauma such as abuse may influence the development of this disorder. People with this disorder may also have experienced a time when they were ill and grew used to and desired the constant attention and nurturing that they received.
In general, sufferers of Munchausen's or Munchausen's by proxy have long, inconsistent medical histories with symptoms that cannot be matched to a known disorder, as well as numerous hospitalizations. They have an eagerness to undergo diagnostic surgeries or tests, above-average knowledge of illnesses and their symptoms, seeking help from doctors, and are reluctant to allow professionals to communicate with family members.
People with Munchausen's may also fake a relapse after the imaginary illness is cured. They may develop new symptoms after a medical test returns with a negative result. They may have low self-esteem, and people cannot vouch for the illness, meaning that people have not seen or noticed illnesses in the patient.
Munchausen's patients are at a heightened risk for physiological problems due to their self-inflicted illnesses.
They are also more likely to develop substance abuse or to attempt suicide.
Munchausen sufferers are excellent liars, and it may be difficult to separate truth from fiction.
People with Munchausen's disorder are experts at altering medical information and faking symptoms. They often contaminate specimens, such as urine samples. They tend to lie about their medical history, claiming that they have had a previous illness, such as seizures, when in fact they have not. And they may purposefully induce symptoms or intensify previous illnesses by reopening wounds or taking medications they are not prescribed.
If a doctor suspects a patient has Munchausen's, they will contact a psychologist who uses a diagnostic and statistical manual of mental disorders. In order to diagnose them with Munchausen's, the patient must meet the following criteria: intentionally faking or producing symptoms, a motivation to be seen as sick. The motivation, however, isn't for financial or legal reasons, such as collecting a settlement.
Ironically, a patient diagnosed with Munchausen's often will not willingly accept the diagnosis and receive treatment. This is a major hurdle in the recovery of the patient.
If the patient does choose to receive treatment, then the doctor will initially use psychotherapy to help the patient alter their behavior and prevent them from abusing medical resources. After that is accomplished, the doctor will research any underlying cause of the disorder. There are no medications that directly treat Munchausen's, although someone with the disorder may be prescribed medication for something else, such as depression.
Although there is no surefire cure for Munchausen's, it isn't impossible for a patient to overcome their disorder and free themselves from their constant overuse of medical resources.
Due to the amount of lies involved with Munchausen's, it is difficult to have any reliable statistics, but Munchausen is considered to be a rare disease.
We'll be back after this.
I'm so alone. I just want somebody to care.
Mr. Mooney, I have your previous medical record histories, and you have a lot.
Yeah, it's been a couple of rough years.
Mr. Mooney, I'm glad to see that your test results from the other day were negative.
You sure?
Yes.
There's nothing else you can do?
No.
So you don't believe me?
Well, your test results were negative.
I need this.
Well, if you'd like, I can recommend you to a doctor. Her name is Dr. Friedman. She specializes in your symptoms. And if you'd like me to set up an appointment.
Whatever you do.
Mr. Mooney, it says here you've been hospitalized several times. You had seizures abused as a child? Mr. Mooney, from what you're describing here today, I believe that you have Welcome back to our informative segment on Munchausen syndrome.
Munchausen's by proxy, as Allie mentioned earlier, is when a caregiver lies about or induces an illness in the person they are caring for. The movie The Sixth Sense has an excellent example of this.
As you can see, the clip shows a mother intentionally poisoning her daughter's food to make her ill. Although we cannot be sure that the mother was doing this for attention, it is still a powerful example of the outcome Munchausen's by proxy often has.
Munchausen's differs from another psychological disease called hypochondria, in that people diagnosed with hypochondria actually believe that they are ill, while people with Munchausen's fake illness for the attention that they receive.
For more information, you can visit the following websites or check out these titles.
And now for the weather with Misty.